Welcome everyone to the Erwin Mitchell webinar on veterans mental health. This webinar is part of the mini-series that Erwin Mitchell are running this week to highlight and discuss various issues and topics surrounding mental health in the lead up to International Mental Health Day, which is this Saturday on the 10th of October. Thank you to everyone for joining myself and the panelists today, and thank you to those individuals who have already submitted questions. If you would like to put a question to our panelists, then you can do this via the Q&A function on your screen, and then we'll put the questions as we go on. This webinar is being recorded and will be available afterwards to view. We'll also be posting a link for a very short feedback survey, so please take a couple of minutes to let us know your thoughts on today's virtual event. So if I could introduce our panelists for this event today. So we have Dr. Jenny Ormeroyd. Jenny is a consultant clinical psychologist who specialises in PTSD and complex trauma. She has extensive experience with working with military veterans, providing assessment and intervention. She's also a medical legal expert, writing reports for war pension and armed forces compensation appeals. We also have joining us today Dr. Viana Stefanadova, who is a counselling psychologist with considerable expertise and experience of working with veterans and trauma at various stages. Biana has worked for Combat Stress, the military charity, for 2 years, supporting veterans with complex PTSD, anxiety and anger management difficulties. And finally, we've got Mark Perryman. Mark is a commercial training manager at the Defence Medical Welfare Service. Mark is also an RAF veteran, and as a DMWS welfare officer, he completed operational tours in Northern Ireland, Iraq and Afghanistan. Mark leads an award-winning team at DMWS who undertake mental health first aid training. So he's worked with the military community, commercial and local government organisations and the charity sector. Sadly, Mal Robertson, who was also due to be a panellist, is not able to make it today due to some technical issues at his end, and I'm sure we've all experienced those over the last 6 to 7 months working from home. Jenny, can I come to you for our first topic of discussion? In your experience, have you seen general trends or a change over the last 12 months in relation to PTSD and the veterans community with the impact of COVID, or has there been some general changes?
I think it's probably important to remember that there is quite a delay in presentations for a lot of people. So we still see a lot of veterans coming forward that served in Iraq and served in Afghanistan, and even that served further back in Northern Ireland and the Falklands. So I think that there are a lot of people that are still coming forward. I think that COVID has had an impact on veterans in terms of being able to access the usual mental health services. A lot of services have gone remote during this period, which I think will suit some people, but I think might be a barrier for other veterans in accessing the help that they need.
Thank you. Biana, I know in terms of with Combat Stress, having looked at their website quite recently, there's a lot of virtual services and help there. Is that something that's been accessed quite regularly now with veterans in this kind of new world that we live in now?
Yeah, absolutely. So generally within Combat Stress, what we tend to offer is residential treatment. Obviously, since COVID started, that hasn't really been possible. So at the moment, we have shifted to entirely either online or telephone support. So a lot of veterans are quite open to that. And have been accessing that on a regular basis. Some veterans are still have expressed a preference to wait for residential treatment, so we have given them that opportunity as well. But a lot of them, as I'm saying, have engaged with sessions either online or via telephone, and I think the majority of them have responded very well to this. Obviously, yeah, for some people, as Jenny kind of said, it's I guess more beneficial in a way, or easier to some extent, because maybe itself saves them a lot of time to travel or other kind of inconveniences like that. But there is still, to some of them, there is that need or more like preference to attend in-person treatment. And I think part of that is just being part of the veteran community that we offer combat stress, because when the treatment is residential, there's a lot of other veterans attending treatment at the same time. So I think definitely that's something that veterans miss at the moment, because that's not available online. Thank you.
Jenny, one of the questions that we were asked was in relation to the Veterans Gateway and the help that's offered there with the Transition, Intervention and Liaison Mental Health Service and the Veterans Mental Health Complex Treatment Service. Do you have any personal experience in relation to that, and how effective is in terms of the help and support that they can offer veterans that are leaving the military and moving into the civilian world?
Yeah, so I was part of a service that later became a TILS, so a Transition, Intervention and Liaison Service. And until the start of this year, I was part of the Complex Treatment Service in the North. What I would say about those services is that I really believe in the ethos behind them, which is about recruiting people that have a knowledge of the military and an understanding of the military to be able to bridge that gap between somebody coming out of military services into a civilian environment, to try and provide a single point of contact. So I think the ethos behind it is really good. I think the issues with the practical running of the service are that it's quite difficult to find those people to recruit. So finding people that have the right skills and that have the right understanding is difficult. And I think many of those services run across quite large geographical boundaries because they're regional services, and I think that there are some operational issues because of that as well. So I think they're a really good idea, but there are some practical issues in the operation of them.
Mark, just bringing you in on this, as a veteran and somebody that works within the mental health world in terms of training, I mean, what do you see in terms of the effect of the transition of leaving the armed forces and moving into civilian life? And what's your view in relation to the support regarding that?
So I think looking at TILS and CTS, anecdotally from what I've heard, when we've been delivering training, whether it's with local authorities, NHS staff, groups of veterans, is positive. But as Jenny says, there are some limitations, and certainly I know TILS and CTS do sometimes see people at our premises, so they don't have to travel and so forth. But I think the biggest thing that I hear is about people not being aware of it. And that's certainly the case when we work with serving personnel. I put a slide up about resources and say how many people have heard of TILS, and usually no one has, and that includes medics. So they haven't heard of it. I suppose the good side is that the Defence Transition Services, which is again a fairly new initiative, are very much aware of it, and I think as that starts to kick in and that starts to work, more people will become aware. But I think there's some education to do in terms of currently serving personnel. I think there's sometimes an element of people perhaps not wanting to think about when they have to leave, but it's important that they do, and I think it's important that they're made aware of what services are available. There's still, I think, as well, if you look at social media, a lot of myths perpetuated around post-traumatic stress, and certainly around the care available. So I think the issue is not that there isn't enough care, it's that people aren't finding it.
I mean, you make a really good point there, Mark, in terms of the communication and messaging in relation to the support that's out there. I mean, it's a while ago now, but I remember that certainly when I left the armed forces, you're concentrating on your resettlement package, you're thinking about your accommodation and where you're going to be. But there is this bubble that you live and work within the armed forces. And there's, when you join, there's a big parade, there's a big celebration with all family and friends being there. But when you leave, it can actually be quite a, dare I say, a lonely experience of handing in your MOD 90 and driving out that camp gate for the last time. But nobody actually sits you down and kind of warns you as to the effect of that and what's there. Mark, do you think, therefore, in terms of, when you look at the resettlement packages, this is something that perhaps should be a little bit more focused in terms of mental health and well-being?
I think so. I mean, I think it's improving. I will say that. I mean, I can look at when I left and how different it is to today. Maybe there's still a bit of reluctance to sort of raise the issue of mental health sometimes, that it's still a bit of a stigmatized subject. But I think the information people are getting is improving, but there's always room to improve it more. And I think if you were to look at, what's the effect? So is the information that's being currently provided effective or not? And if it's not, how can we change it?
Okay, thank you. Just moving on a little bit in terms of topic, there's been obviously an increase in relation to women and their role within the armed forces, particularly in combat roles. And there was a recent study by the King's Centre for the Military Health and Research in regards to the effect of PTSD have on women. Jenny, have you looked at this particular issue and topic, and have you read that study?
Yeah, I have. I think there's been a couple of studies that have been done recently. Forward Assist did a really useful qualitative study about female veterans' experiences. So I think we are starting to understand a little bit more. I think there's still not a lot of research out there, particularly in the UK, but there is some research that indicates that I think both that women find transition harder and that PTSD rates can be higher in women as well.
Okay. Brianna, I just wondered, in terms of your work with combat stress, whether this has become a bit of an issue and a topic, and whether you've seen an increase in relation to women coming forward with PTSD symptoms.
To be fair, yeah, so women in general are, as research says, they are a lot more likely to develop symptoms of PTSD. In terms of what we see as a client group, female veterans are a minority in terms of veterans who access support from combat stress, which I find kind of interesting. I think there's a bit of a difference in terms of how female veterans might experience PTSD, mostly because they might come across different issues. There's a lot of kind of literature, and our experience also shows that female veterans are more likely to experience sexual types of trauma in the military, in addition to other combat-related trauma. So this obviously adds another level of complexity. Obviously, this doesn't necessarily mean that this is the case for everyone, but that's kind of almost like an additional complexity, as I was saying. But in terms of increased number of female veterans accessing support, I haven't noticed any tendency for that. The number of female veterans looking for support is still relatively small, at least in our service.
Jenny, I just want, in terms of your NHS practice and what you see there, have there been an increase in numbers in relation to that for women in terms of PTSD and the military?
It's hard to say. I mean, women only make up, I guess, 10-11% of the armed forces. We probably have seen slightly higher than 10% of the overall referrals, but not a lot higher, I wouldn't think, no. Okay.
And Brianna, I know, in terms of looking at, again, the combat stress website, that moral injuries has become quite a hot topic, and something that combat stress are looking at quite carefully.
Yeah.
Could you just explain in terms of what is meant by moral injury and the impact that has in relation to military personnel?
Yeah. So moral injury, kind of broadly defined, is basically any experience that veterans might have had a direct input in, so basically by action, or sometimes by inaction, for example, by witnessing some sort of an experience which clashes with their moral or ethical views, and that's what it's meant by moral injury. This is a kind of very unique type of presentation. It's not considered a mental illness in itself. It's just the type of experience that I described, but it does contribute a lot to symptoms of PTSD, and it's almost considered like a risk factor. Moral injury very often has an additional kind of negative impact on veterans because it's associated with strong feelings of guilt and shame. Very often there might be sense of worthlessness for some people, because it's very common that veterans will experience that sense of responsibility, personal responsibility, regardless of whether they've been an active agent in the event or have just been a witness and haven't been able to prevent it. There's often that sense of responsibility which contributes to the feelings of guilt and shame. And when that kind of contributes to a strong negative sense of worthlessness, that can really have an impact in terms of low mood. Some veterans present with risky behaviors. Substance misuse is a very kind of common coping strategy. So yeah, it's almost like a separate type of trauma which needs to be treated differently. But unfortunately, there's not any kind of evidence-based treatment recommendation for that. So we try to use the knowledge that we have so far in terms of treating other trauma presentations. So yeah.
Mark, is that something that you've experienced in terms of the work that you've done from DMWS in terms of, you know, the moral injury, particularly obviously integrity and having moral courage is something that is, you know, a big part of military service?
Yeah, I think our welfare officers are seeing it more, and I think they're more aware of it now. People are generally more aware of it. I think in terms of it creating isolation sometimes from the civilian community, people feeling isolated because of what they've gone through and feeling that people won't understand them. And I think that's been a fairly common thing. I think identifying it off sometimes as moral injury is what we haven't done in the past.
And Jenny, in terms of your experience, from a clinical perspective on moral injury, have you got any views on it?
Yeah, I think I would agree with the comments that Bojana made about how it presents. So I think I would see probably a higher level of shame in people and also more of a sense of alienation, so struggling to relate to other people or sometimes struggling even to be able to talk about their experiences. I've worked with people that have presented with PTSD but also with an element of moral injury, and sometimes they need to be able to build that level of trust up before they can talk about some of those experiences that are more difficult because they worry about how they're going to be perceived. I think it has quite a significant impact on a person's belief systems, whether that's the beliefs about themselves or the kind of trust and sense of justice within the world. So I think those things can change for people as well.
I just wondered, Jenny, from a clinical point of view as well, whether there's any kind of ethical considerations as well for somebody that's treating somebody with a moral injury, particularly if they, you know, confess to something, you know, that leads you to think there may be an issue here that I have to report, and being a breach of confidentiality. Is that an issue for clinicians as well then when they're dealing with these injuries?
Yeah, I do think it is. It's something that we discussed a lot when I was working within veteran services, and I think it's a balance for me, and I think you have to take this on a case-by-case basis, but I think it's partly about being clear about the boundaries around confidentiality, at the same time being able to create a safe space in which somebody can talk about the things that they need to be able to overcome it. So we took certainly advice from kind of safeguarding teams and looked at guidelines on this to make sure that we could both safeguard the well-being of the veteran and create a space in which they could talk safely. Thank
you. Mark, one of the questions that's been asked by one of the viewers, and it goes back to a point that you made earlier in terms of communication, and the question is, how can we break down the barriers with GPs in relation to, you know, the veterans community linking in with the NHS? And I know DMWS work quite closely with the NHS and the military community. Have you got any comments or advice there that you might be able to give to the veteran or to GPs in that regard? I'm
not sure about being able to give advice, but I certainly think it's an issue, certainly. And I know when I spoke to my own GP, no idea of what's available. Having said that, he then showed me his email inbox with about 80 emails from NHS England telling him about things he had to do. So I think we have to recognise that veterans are just one part of what the NHS and what GPs have to deal with. I think the answer is education, and we run Armed Forces awareness training. We've delivered it to a number of local authorities, to some NHS services. That has occasionally included GP GPs and their staff, but time for training for them is a real issue. That's always been the thing, and I've been to a number of practices who are very keen to know more, but simply don't have time or resources available to do training. So I think that's something that maybe has to come from the top.
Jenny, I can see you nodding there in terms of is that your experience as well? The message is getting out, and the frontline GPs and the NHS services just don't have the time to go through that process that Mark's talked about there in terms of the learning and understanding.
Yeah, I would agree with everything that Mark said there. I think that GPs have less experience of working with the armed forces community than they would have had at one time. I think the armed forces are maybe less visible in the public now than they would have been. So I do think there is less understanding and there is a need for education. I guess one of the things that the Transition Intervention Liaison Service tried to do was provide a single point of contact so that people, certainly for mental health difficulties, didn't need to go through a GP, but could go to a place where somebody would have that understanding already. And I think there's been some work done on trying to develop veterans champions as well, so that people have that knowledge and other people in the practice can come to them to get that understanding if they're working with a veteran.
Brianna, coming to you, there was a question that was put about military officers and the chain of command, and whether there is anything there to offer officers specific help in relation to anxiety and mental health issues and PTSD, in terms of whether self-help or internally. Do combat stress look at that in terms of rank structure and what might be appropriate in terms of the help that can be given, or is it a case of one size doesn't fit all?
Well, I think we do have an individualized approach, but within the merits of evidence-based practice. So I wouldn't say that we use a one-size-fits-all approach, but we try to stick to the guidelines as such, and then obviously within that kind of look at individual needs or individual differences. In terms of kind of what support or self-help is needed or could be beneficial, I think it's really very much about talking about these issues within the forces and offering support. I think a lot of veterans that we see present with a lot of stigma, and as we were talking earlier, there's a lack of awareness in terms of what PTSD is and why it develops. So a lot of veterans perceive that what's happening to them is not normal, or that they think that they're going crazy, that kind of thing. So I think it's very much about increasing awareness and encouraging a more open environment, a culture where these things are spoken about, again, to increase that awareness. Self-help materials, I can direct you to our website, especially now with the COVID pandemic. We have been working a lot on developing some self-help materials, so these can be found on our website, combatstress.org.uk. But kind of shortly, the key thing I would say is to try and use strategies that help you regulate the emotional arousal, whether that's breathing or grounding exercises or relaxation exercises, anything that helps kind of regulate arousal, basically, kind of to put it shortly.
Mark, do you think there should be more follow-up with veterans? So anybody that leaves the armed forces should have some kind of follow-up, say in 12 months' time. I mean, that could be done by, dare I say, DMWS or the MOD themselves, just to make sure that transition process into civilian life has gone smoothly. Yeah,
I mean, I think it's a great idea, and I'm sure if MOD were to come out with the funding, we'd be happy to look at it. That's always the issue. I think it is something that Defence Transition Services are aiming to try to do, but they're aiming to identify people who are more likely to have issues before they leave, and then to track them for as long as necessary and ensure they get help. But yeah, I mean, I think a contact after 12 months would be a great idea to find out how people are doing, because I think people often don't understand or don't foresee what transition is going to be like, and that even for people who've served for a long time, it can be like falling off a cliff. You know, I've certainly known someone who spent 38 years in the forces and simply didn't want to think about what it would be like to leave. And that created a huge issue for them. But I think when we're working with serving personnel, you know, there's a great desire, I find, in them to know more about mental health, to have that open atmosphere and to talk about it more. But again, that sort of, you know, our ability to go in and train people, to give them some awareness is limited always by funding.
Yeah, it's a difficult one, as you say, when it comes down to money. Jenny, is that something that the Veterans Gateway in an ideal world would want to do, or, you know, to the proactive follow-up with veterans, or is that something that is just never going to happen because of cost, because of time?
I think it is a really good idea. I think some of the difficulties is partly tracking veterans when they leave, because they often move around. So for the MOD to be able to still identify where people are. And then I think there's lots of work being done to try and identify who is a veteran, for example, using GP codes, that I think has also come up against problems, because not everybody will identify themselves as a veteran or want to be seen in that way. So yeah, I do think it's worth an attempt. I think, as Mark says, there might be some issues around cost, but there might be also some issues around identifying those people.
Okay, Biana, one of the questions that has been asked is, what advice would you give to a military family member whose partner, parent or sibling has been diagnosed with PTSD? Because this is obviously, it has an impact on the family unit. I'm sure you see that. And is there any advice or guidance that you would give? Or Jenny, I'll put that question to you, and then obviously I can come back to Biana.
Oh, sorry, I was on mute there. I forgot to unmute.
That's okay.
Sorry about that.
That's okay.
So yeah, I was starting to say that having a family member with PTSD can be quite difficult. So the first thing I would like to say to people who have a family member with PTSD is to look after themselves and to attend to their own needs, because I've seen a lot of family members in their attempts to be there and support their partners or their siblings, almost like neglecting themselves, but you need to have your own resources filled up before you're able to care for others. In terms of actually supporting people around you with PTSD, I think it's very important to work with them and to be aware of their triggers. So these triggers can result in kind of painful memories, or in what we call intrusions, high arousal or high levels of distress. So I think it's important, first of all, to work with those people to know what these triggers are, and then to help and identify what could be a helpful kind of supporting strategy in that moment as well. It's a very common coping strategy for veterans to try and avoid their level of distress, which is understandable, because when they go back and remember certain events, it's extremely distressing. So I guess it's about trying to not reinforce that avoidance as hard as it is. It's really about trying to support your loved ones in terms of regulating those emotions, kind of going back to what I was saying earlier in terms of using relaxation strategies. I can give you an example. It's a very common presentation for a veteran to struggle with busy places or crowds, or going to, let's say, the supermarket. And it's very common for them to want to avoid that. Avoidance is one of those things that is helpful in the short term, but in the longer term only maintains the problem. So for example, with that, I would suggest to kind of break it down into small steps and approach this gradually. So for example, instead of completely avoiding going to busy places or supermarkets, starting small. So what could be a safe initial step? For example, maybe we can go at quiet hours or something like that when it's not as busy, and then we can kind of move on to gradually progressing to going to such places at more difficult times. So yeah, I think that can be a good way to approach things.
Thank you, Mark. In the mental health courses that you run, is the family unit something that you look at as part of the training?
Absolutely, and I know that some of the research done at King's talks about vicarious trauma in the partners of veterans suffering from post-traumatic stress disorder. But I think any kind of mental health condition doesn't just affect the individual, but it's bound to have an effect on people around them. So certainly, yeah, we highlight that and try to make people aware that, you know, it's not just about looking after the individual, it's about looking after the whole group, their contacts and their family.
And Jenny, in terms of, you know, where we all find ourselves at the moment in relation to, you know, to lockdown and being restricted and where we can go and who we can see, I think I'm right in saying that that's probably going to have a bigger impact, isn't it, in relation to the individual and the family unit as well?
Yeah, absolutely. And I think, as Bojana was saying about avoidance and trying to reduce that, I think one of the challenges of lockdown is that it has possibly perpetuated that avoidance for some people, because it's been harder to go out and have that kind of exposure or be in that environment. And I think it's probably also been challenging because sometimes veterans have maybe been used to having their own space at home and then having other family members there or having children there all the time. I think that will be more challenging for some people that struggle with those kind of symptoms. It might lead to more irritability or just more difficulty finding their own space within that environment. So yeah, I'm sure it will have been challenging.
Yeah, not easy at the moment. One of the questions that has been asked is in relation to medical records and whether the full disclosure of medical records, particularly between the MOD and the NHS, may help a little bit in terms of the tracking of that individual or knowing about those symptoms. I mean, Mark, I'm sure you could comment in relation to military records going missing. You know, I myself being a veteran, Mark, but I just wonder whether you think that would be a possible solution to this in terms of the, you know, the tracking of information between the NHS and the MOD. Would that help?
I think it certainly would, and I mean, I'm certainly well aware of the black hole at Smedley Hydro, where military records used to go to disappear. In fact, I recommend to veterans that they do a subject access request and get a copy of all their medical records before they leave, so that if they need to go and see a GP for any kind of condition, they have a copy of the records there themselves that they can hand over. Because I think one of the stories you hear time and again, and you know, I say things are improving. So, you know, we have got the veterans aware hospitals, we've got the veterans aware GP practices, although there aren't very many of them. But I think the fact that people are still, because of this lack of knowledge around tills and services like that people can self-refer to, time and again people get sick of telling the same story over and over again to different people. So they go to the GP, they tell the story, the GP refers them to the general NHS mental health service, and then they have to tell the story all over again. If they had a copy of their records, I think that would help no end. So whether they get them themselves or they get given them, I think either way, that should definitely happen.
Jenny, I don't know from your perspective in terms of working within the NHS, whether that was something that practically could work, or do you think it's something that could solve this particular problem?
Yeah, so when I worked as part of a specialist trauma service, we routinely accessed military medical records. I think some of the difficulty was just the delay of them coming through. So I think it was fine if a veteran had their own records themselves and they were happy to bring those to a session. Otherwise, we were waiting often quite a while to get access to those records. So it wasn't really working to stop that veteran having to go through everything again. But yeah, I think if that process could become more efficient, it would be really helpful.
Just before we think about sort of wrapping this webinar up, I'm just wondering whether each of you could give any practical tips or advice, particularly in relation to, you know, where we, as I say, all find ourselves now in this rather interesting and new world that we have. Jenny, if I could start with you, is there anything there that you could offer in terms of advice and tips, or in some respects how things have changed now in terms of the, how people can look after their well-being, and veterans can ensure that their mental well-being is as good as it can be.
Yeah, I think my main message would be to know that you're not alone if you are struggling with mental health when you come out of the services. I think 1 in 3, possibly in the general population, struggle with mental health at some point. And what I found in working with people is that one of the biggest barriers is about people's acceptance that they have been affected by those experiences, and kind of beliefs that that's a weakness, or that they should be able to sort their own problems out. That means that people are often delayed in seeking help. So I think if you are able to seek help, it actually shows a lot of strength. And there is, I think, as Mark mentioned earlier, there is a lot of help out there. I think it can be quite confusing at times as to where to go, because there are lots of services that do lots of different things. But it's worth looking. I think the COPSEO website has a list of all the service charities. That's quite a good place to start. And yeah, just don't be afraid to go and ask for help.
Mark, any top tips?
Yeah, I think in addition to everything that Jenny has talked about, I think Veterans Gateway also, because that runs in conjunction with COPSEO, has really good resources. I think I would stick to websites like that, because there are some fairly dubious ones out there as well. And with service charities, lots of them are doing some more online support. Our own welfare officers are in hospitals, so veterans in hospitals can access that service, or our own website has details of how to contact them. And I think otherwise it's a case of making the best of it. And I think ex-service people are very good at that very often. It brings makes you more aware of your own resources. And I think that's focusing on that is a really good idea.
Thank you. Bianca, finally to you, any top tips and advice there in relation to anything that you can give? Particularly, I know Combat Stress has a lot of virtual videos and self-help things on their website already, but I just wonder whether you could highlight anything specific.
Yeah, well, I think, first of all, I want to kind of follow up on what colleagues were already saying. I think it's really important, especially now under COVID and with kind of increased feeling of isolation, to stay in touch with people that you love and care about. And yeah, look for support, even if it's not necessarily kind of formal support, but I think it's very important to stay connected with those around you and speak to them as well about what's happening and how you're feeling. In terms of the resources on Combat Stress's website, yeah, you're right. We have worked on, as I said earlier, developing a kind of a library of resources and videos that you can access on our website. There's resources in terms of COVID. There's resources on PTSD, anger, low mood, alcohol, and substance misuse. So kind of mental health presentations like that, so you can go and have a look. I think right now it's really important, also in relation to not feeling isolated, is to try and do things that you enjoy to help you look after yourself. Staying active if you can, going outside, getting some fresh air, or if not, if that's not possible for you, even if it's just about opening the window, but just getting some fresh air and doing things that you like and that you enjoy, kind of staying in touch with those activities, because that is really important for our mental health as well. And yeah, there's more kind of detailed specific strategies for regulating the stress and relaxation and grounding. There's more information on our website.
That's great, Bianca, thank you. So I'd just like to thank each of our panelists. Thank you very much for your time today and taking the opportunity to talk about these issues. I understand that the feedback link post has already been put on there, and if you follow the link on the final slide, then you should be able to see the rest of the events and webinars that we've got planned this week. You can see at the top there in relation to the link to follow that through, so you can see in terms of the upcoming topics that we've got some really interesting ones there. Thank you everybody much for taking the time to watch this event today, and take care. Thank you.